As we said near the beginning of this DVD, one of the biggest reasons people give up running is because of injury. And it's really unfortunate because the vast majority of those injuries are avoidable.
In particular, overtraining is a killer for new runners. You want to see results as quickly as possible, and it's easy to believe that the harder you train, the quicker you'll see those results. As you now know, that's not the case, and you're already way further ahead than most.
Just remember to listen to your body. If you feel as though you may be overtraining, take the day off and don't make the mistake of trying to make up for a missed day. Just pick up where you left off.
The human body is really an amazing thing. As long as you keep challenging it, it will continue to adapt and grow. Be patient. It doesn't happen overnight. Even still, you'll sometimes have pain during and after your run.
The first thing you need to do is to determine whether the pain that's associated is it really an injury or is your body just sore. It can be difficult to differentiate between the two, especially if you're new to physical activity. The truth of the matter is that whenever you run, there are always going to be some nagging aches and pains.
If the pain moves around, it's a sign that you have sore or stiff muscles. Most aches and pains will run their course in 3 to 4 days, although you can often speed it up by icing the area or getting a massage.
Sharp localized pain is a sign that something is wrong. If your pain lasts beyond 3 or 4 days and is showing no signs of getting better, you probably have an injury and should seek medical attention.
Some of the other questions you can ask yourself are, does the problem limit your training volume? Does the problem cause you to alter your training biomechanics? Does the problem affect your normal daily activities? If any of the answers are yes, you need to see a doctor.
Generally speaking, most beginning runners experience problems below the knee, in the heel, or the arch of the foot. Injuries above the knee are usually a result of higher mileage training. As a general rule, remember to train smart and stretch after every run, and you'll avoid some of the pain that comes with running. However, injuries will happen. Here are a few common injuries and treatments to help you get back on your feet.
Plantar fasciitis is a common foot injury that causes pain in the heel. It happens when a band of tissue from here causes inflammation from your heel to the ball of your foot. There are a lot of strong tendons in your foot, and like any other tendon, they can get irritated and inflamed. To treat, rest the foot for a few days, icing regularly and taking anti-inflammatory medications to reduce the swelling. Once the pain has been reduced and you are ready to run, keep up a regular routine of stretching your foot after every activity. Finally, this type of injury is most often caused by having the wrong shoe. Be sure to see a good shoe tech and make sure that your shoe has plenty of arch support. If you continue to have problems, you may need to see a podiatrist about getting orthotics.
Patella tendonitis is a knee injury which involves sharp pain around the kneecap, commonly felt when kneeling or jumping.
The patellar tendon is a muscle that runs from the kneecap to the shin. It can become inflamed due to overuse. Treat with plenty of rest, anti-inflammatory medications, and regular icing around the knee and tendon. Once you start running again, make it a priority to stretch the quads, hamstrings, and calf muscles after every walk and run. Apply ice directly to injured areas for 15 minutes every hour, no longer.
Finally, strengthen your quads with lunges and squats to prevent further injury.
Runners will also sometimes suffer from pain in the calf and Achilles tendon. It most often happens when you're wearing old, cheap, or simply the wrong type of shoes, or when you drastically change your running distance. Achilles tendonitis happens if you overpronate when you run, looking something like this. You'll feel pain mostly in the back of your heel, where your tendon attaches to your heel bone. This is not an injury to take lightly. Continued overuse can cause tears in the tendon itself. Treating Achilles tendonitis is the same as most other running injuries. Rest, ice, and take anti-inflammatories to reduce the swelling. Stretch your heel after every run by standing on the edge of a stair and dropping your heels. To prevent further injury, try using a heel wedge. These are available at most running and footwear shops. Finally, you might also feel what is commonly called the shin splint, which involves a sharp pain along the outside of your shin bone. This isn't actually one injury, but a term that covers a few different pains over the shin bone caused by overuse. You'll most likely feel a dull, aching pain here, just around where your tibial bone is.
Shin splints are mostly caused by overpronation and overuse. Running is a high-impact sport, and it takes time for your bones and muscles to adapt to your training schedules. If you are regularly getting shin splints, try footwear that controls the pronation, such as the M3 shoes offered by Karhu. Try mixing up your running training with a lower impact activities such as swimming, and remember to ice, stretch, and take anti-inflammatories to reduce the swelling.